All right. Well, I've noticed hormone replacement therapy happening with very young people in their 30s around our age. And not only friends of mine saying I'm doing hormone replacement therapy, or I like my doctor put me on testosterone, but now big influencers are also posting like, "Hey, I'm I'm doing hormone replacement therapy." So today we're going to talk about what that does for you, whether it's a good thing, and like is there a healthier option, because that seems pretty unhealthy. Here to join me is Dr. Bradley Campbell. I just want to show you a couple of the influencers. So Alex Hormozy, this is his post.
Yes.
Now he in this post he explains that for 14 years he did body built without hormones. That picture is supposedly without hormones, and then he started doing hormones in his 30s, and testosterone replacement therapy, and it works great for him. He said, "Okay, now Emily Hayden also made a post saying that now that she is on hormone replacement therapy, she feels so much better. She was dealing with a lot of symptoms of like uh, depression and exhaustion. She says it's bioidentical hormones, not synthetic. And she was basically in an emotional hole, she said, and it helped her immensely. There was another influencer who said that her doctor put her on testosterone, and she has so much more energy. So, Dr. Campbell, what is your reaction? Why are doctors putting young people? Because I think the last girl I mentioned, I think she was in her 20s actually. Why are young people going on hormone replacement therapy?
So more doctors are prescribing it because it is an easy fix for a problem of burnout or adrenal fatigue or hypothyroidism. I mean, 30% of Caucasian women get hypothyroidism, and 90% of those cases are Hashimoto's. So you got about 1 in 4 or more women walking around with Hashimoto's, usually
That's a
undiagnosed.
big percentage.
It's huge. So rather than actually finding the root cause, which is usually burnout, adrenal fatigue, nervous system exhaustion, poor sleep habits, too much screen time, not enough time outdoors, all of the things that we know to be healthy, it's a much easier way to fix the problem by just giving somebody hormones, whether it's bioidentical or synthetic. You're basically just kicking the can down the road. So the problem is still there. It's like pulling the fire alarm off of a burning preschool. You still want to save the kids in the preschool. So just because you're taking testosterone therapy and feeling better, or a hormone injection pellet, or whatever it might be, just because you're taking hormones and feeling better, you're not fixing the root cause. There's still some sort of underlying inflammatory problem. The school's still burning. You still might not be sleeping well. You still might have excess stress to deal with. Your diet might not be working for you. You might have a gut issue or infection or parasite or yeast imbalance. So all of these doctors are just giving quick fixes. And it's not like we have a Tylenol deficiency that we're born with. We're not born with a birth control pill deficiency or a hormone injection deficiency. We don't need to like shoot ourselves up with the testosterone just to feel normal. We need to have a healthy lifestyle and diet, and that will cause us to feel normal.
Okay, but for people like Emily Hayden, I follow her. I've been on her podcast. She's wonderful, and she's also a health nut, and she's
Yep.
holistic, and she does the spiritual work and everything. So, what for people who've done? They're like, I've done everything, nothing's working. What could be missing that you could still do?
Yeah, they're definitely missing something. Again, they have to do better testing. And a lot of functional doctors or even holistic doctors are not actually very well trained in root cause diagnosis, which is why I'm focusing more on teaching practitioners now, because a lot of MDs, DOs, nurses, they go to a functional medicine weekend seminar and they say, hey, everybody's got this issue. Here's the one size fits all treatment approach, whether it's herbs, whether it's a physical hands-on treatment, or oftentimes it gets into DHEA, pregnenolone, bioidentical hormones, testosterone, et cetera. And they're not looking a little bit deeper, which would be doing a full thyroid panel, doing a salivary cortisol test for your adrenals, or doing something called a Dutch test, which is a urine test. It's very easy to do. And you actually find out why the hormones are off in the first place. So rather than just give hormones to everybody, it says, why is that actually a problem? And if they were just to go a little bit deeper, they might find it. But if I could tell you how many times I hear I've tried everything and nothing's working, it's usually because they haven't tried the right thing for long enough, or they haven't found somebody who can look at the big picture perspective. There's a lot of doctors out there who don't really know how to look at the adrenals. I wrote a book called Do I Have Adrenal Fatigue that looks on it, talks all about it, and they don't usually run a full thyroid panel. They run maybe a T3, if you're lucky, usually just a TSH, and rarely the antibodies. So when you look a little bit deeper, you can find those root causes and address them, usually with adaptogens, some adrenal glandulars or thyroid glandulars, a couple of vitamins, minerals, B complex, magnesium, all things that a lot of people feel good taking. But the reason why they feel good with those things, or feel like they need electrolytes, or they crave salt, or they crave sugar, is because they have an underlying problem that's not being fully addressed yet.
What are the long-term effects of someone going on supplemental hormones for so long?
So it really depends what the hormone is. Hormones are kind of like Goldilocks. You don't want them too high or too low. You're going to have major issues. So you want them just right in the middle zone. So if it's something like testosterone injections and you're getting a massive surge, that can cause prostate health issues long-term, particularly heart issues. And a lot of people on testosterone therapy injections or pellets or oral or topical use of testosterone end up with more irritability. They'll eventually, as it gets to be excess and they don't need it anymore, they can have angry outbursts or rage. So testosterone is one of the most damaging of all the hormone replacement therapies. Estrogen and progesterone, if they're not perfectly balanced, could increase the risk of different reproductive cancers or breast cancers. So uterine cancer, breast cancer, etc. So you just want to be very careful that you're having your levels checked on a regular basis while taking some of these hormone therapies.
Wow. Well, these people are not reporting anger outbursts. They're saying, I feel so much better. I'm happy now.
Yep. That's usually the first step, is like you're in adrenal fatigue. What you have is, first you have a stage. There's 3 stages. You have sort of like wired, high alert, high stress, like usually people like Alex who are overworking and able to keep up. And then the stage 2 is when you get wired and tired. So you go from stage 1 of like high cortisol, where you're kind of like a squirrel and you're running the hamster wheel all the time. Then stage 2 is wired and tired, where you're using uppers, maybe some ashwagandha or adaptogens or breath work or cold plunges even, or some sort of stimulation. Caffeine is the most common one, or energy drinks, to stimulate yourself awake in the morning. And then you're using something to calm yourself at night. But people end up sort of tired and stressed, or depressed and anxious at the same time. And then stage 3 is full burnout, where you're kind of like a sloth stage, where you're just completely collapsed. Your testosterone and a lot of your sex hormones deplete, and they all pretty much drop low. You get more of a fatigue without the high cortisol. And that's usually when people like those influencers take testosterone, because it is the quick fix solution for that burnout stage, and they feel way better. But your body can make testosterone itself. And if you give it the right ingredients, it is innately intelligent and can make high levels of testosterone, but you just have to give it some basic needs, and then it'll do it on its own.
What does your body like forget how to make its own hormones? If you're taking fake hormones and then you're like, let me just do this for a bit to get back on track, and then I'll get off. And then you get off, then what happens?
So some people's body does make the hormones again itself, but it can take a period of a few months to do so. So you can go through a withdrawal period when you hop off of them, whether it's intentional or not. And it can take 3, 6, even 12 months, whether it's birth control pills or hormone replacement therapy. It can take time for your body to become fertile again. It can take time for your body to become self-sufficient to make its own hormones without the exogenous hormones that you're taking in either orally, through injections, pellets, or on the skin topically.
Okay, so if you want to just fix your burnout naturally, what's the first actual step? Like, do you find a holistic doctor or what?
Yep, I would recommend finding a holistic doctor of some sort, usually one The best ones I found use some sort of applied kinesiology, which is a muscle testing form of biofeedback. They can go to icakusa.org to find a practitioner near them if they're in the United States, or there's an International College of Applied Kinesiology where they can find an international one. But usually if you ask around or Google applied kinesiologist near me, you can find one. But to truly get better, there's like a few non-negotiables. One is getting at least 7 hours of sleep. The second of three would be minimizing stimulants, like at least 1 cup or less of caffeine a day, if not 0. And then the third one is going to be eating 3 meals a day. A lot of these people thought that holistic natural health meant intermittent fasting and calorie restriction to lose weight or feel better or look a certain way for Instagram influencership or whatever it is. Alex was a bodybuilder. And so you basically have to sleep, reduce stimulants, and then eat more regularly, because a lot of people are doing things that look aesthetically better, or they're going for performance like bodybuilding, but that's not actually healthy.
Eat more regularly?
Yes.
You just said, what is that?
A lot of people are eating 1 or 2 meals a day. Intermittent fasting is the new most popular trend. And so that's something that can't really be done. If your body is in any sort of hormonal burnout, adrenal burnout, thyroid dysfunction, skipping a meal is very difficult. And a lot of these people, they end up intuitively skipping breakfast because they need a stimulant to wake up. Breakfast causes their digestion to be a little bit more burdened with blood flow to the intestines rather than to their brains. So they get tired if they eat in the morning, or they get nauseous just even thinking about eating in the morning. So even just starting with a few berries, working your way up to eating 3 full meals a day is very helpful when someone is in a hormonally depleted state, because if you're not eating for breakfast, your body's going to be running more on adrenaline or cortisol, which just perpetuates the burnout cycle. It's kind of like coffee is like putting gasoline on a fire rather than a whole breakfast meal with healthy fat and protein, which is like a wood burning log to give you energy for the rest of the day.
I see. And what foods should people be eating?
So you typically want to prioritize getting at least 20 to 30 grams of protein per meal if you have hormonal issues, as well as some healthy fats. So whether it's avocado, the meats, animal protein you're eating that has healthy fats like grass-fed red meat, fish, could be eggs. Eggs are great for hormones. It's kind of like the eating eggs for your eggs. That's a great way to do it. Could also have different nuts. Walnuts are great for brain health, but different nuts and seeds are also very good. Chia seed pudding. You could eat, I really like this one, keto oatmeal by Pure Traditions. That's a great oatmeal for more energy throughout the day as well.
Awesome. Okay. Well, thank you so much, Dr. Bradley Campbell, for your tips. Let me show his Instagram, you guys. He is full of tips. He deals with people's hormones a lot. There it is, at Dr. Bradley Campbell. He was actually deleted by Instagram so many times during the pandemic because he spoke too much inconvenient truth. I don't know, but they laid off. They're letting you live on there.
For now, yes. I just have to be a little careful still of what I say, but hormones, at least, they don't seem to care about.
Okay, good. Well, thanks so much, Dr. Bradley Campbell. Great talking to you.
Thanks, Ivory.